So my teams with the CSB are made up of the jail-based services team, the jail diversion team, and then all the newly grown specialty courts programs. The jail-based services team has unique duties in that they are providing services to individuals who've been incarcerated at the adult detention center. So they're spending a key focus on risk assessment and crisis intervention for individuals coming in the ADC.
There's no typical day of working in the jail, but we do a lot of crisis stabilization work with the individuals that we serve here.
What I really enjoy is that we have staffing every single day with all of the clinicians as well as the prescribers and the supervisors. So when we do meet with our caseload, mostly in the morning, and we need to collaborate or talk about what symptoms or things that we have seen, we get better feedback from the other clinicians.
You're going to be working really closely with the sheriff staff here, a lot with the deputies, command staff, to kind of do your job in working with the clients that you serve here. In a jail, it's very different from a community-based setting or a residential program. You're going to hear a lot of different noises. They're going to be slamming the doors and things of that nature. It's something that you get used to. There's a lot of walking. It's a big facility, so you're going to be seeing individuals throughout the entire jail.
So the jail diversion team is providing a high level of case management, community-based services to individuals who have been in the adult detention center or have been frequent utilizers of emergency services and are at risk for decompensation if they don't have a high level of service involvement.
Our typical day usually involves me planning my schedule probably about a week or two in advance and then nothing going according to plan. I think that it's important to, again, still remain flexible, have a flexible attitude, be willing to have a flexible schedule, and also keep in mind that you just kind of have to roll with the punches.
I think what I like most about the job is that it's not office-based. I'm not a sit-at-a-desk kind of person, and this job offers a lot of opportunities to go out into the community. Any given week, I'm at the courthouse, I'm at probation, I'm at the shelters, I'm out reaching people in their homes. And there's a lot of flexibility in our schedules to kind of plan that the way that we want to. But with all of the services we provide, there is a lot of corresponding paperwork, so it's important to also schedule into your days time to get that done too. So we have the opportunity to meet as a team 3 times a week, Tuesdays, Thursdays, and Fridays, where we all sit down together and run through the entire caseload that everyone's serving, but also the opportunity to brainstorm resources if people are having difficulties with clients or someone's in crisis, and it's an opportunity to come together and collaborate on some of those more complex issues.
Typically, we have a number of clients we serve who have been homeless for a number of years, so a lot of times they don't have the basic documentation that maybe you or I would take for granted. So they may not have a social security card or a birth certificate or a photo ID. And to get those items in place, you have to get a social security card, a photo ID. That way you can have those items and then you can start filling out applications and progress through the system so that you can eventually apply for, housing, any sort of subsidized housing through the CSB.
In my work at the MCRC, I deal with CSB clinicians on a daily basis. I help them when it comes to serving temporary detention orders, ECOs. I assist the jail behavioral health team with criminal TDOs, jail transfers. If they have any questions for the MCRC staff, local hospitals, state hospitals, we coordinate that, communicate a lot with them, and help build a positive relationship.
And then we have our specialty courts. We're really fortunate in Fairfax. We couldn't have said this a year ago, but today we have a veterans treatment docket, which has been operating since 2015, our drug court, which launched in October of 2018, and our mental health docket, which is already operating and preparing for a July 1 initial docket, although we have something also called the supervised release docket that's been a component of the mental health docket, and that's been operating since last August.